Hello, everybody. Thank you for listening to the Healthy Project podcast. I am your host, Corey Dion Lewis. I have a great guest in the building today. You've probably heard me talk about this organization before on social media, Findhelp.org. Some of you may know them as Aunt Bertha. But I have Vickie Walsh. She's the Community Engagement Manager at Findhelp, a public benefit corporation. Vickie, thank you so much for being on with me today. I appreciate it.
Yeah, thank you so much for having me, Corey. Always a pleasure to chat.
Yes, so I'm super excited about this conversation, Vickie, because like I said, I've talked about Aunt Bertha. I've used Aunt Bertha. We talked about this as well. I've used it for years. So I'm really interested in not only, what you do at findhelp.org, but also that from a social worker perspective. I know that's your background, about social work and health outcomes. But before we get into that conversation, how about you tell the people a little bit about yourself and what gets you up in the morning?
Sure, absolutely. So thanks again for having me, Corey. Really appreciate the opportunity. My name is Vickie Walsh, like Corey mentioned. And so I'm the Community Engagement Manager for Findhelp. I cover the Midwest, which is a wide swath of our country, but very excited. So I live here in Kenosha, Wisconsin, but I've been working with Iowa, Minnesota, Nebraska, the Dakotas, and Illinois. How can I forget Illinois? And so I've been working with Findhelp for about the last 10 or 11 months. So you've actually been on the Findhelp Aunt Bertha bandwagon longer than I have been, but very excited to have joined the team last year. And I wish I had this as something when I was a social worker starting out. But really my why and what gets me up and going in the morning is the idea that everyone deserves to have access to resources, whatever that means for them. As a social worker by trade, so I have my bachelor's and master's in social work. And one of the things that's, I really identified with from the beginning of my social work education was the idea of the inherent dignity and worth of each person and the power of human relationships. And I'm a big believer that change happens at the speed of trust. And there's a lot of change that needs to happen. I think we're all real aware of, I would hope we're all real aware of how difficult and challenging people's lives can be. And so I grew up in rural Wisconsin, northern Wisconsin, and had lots of mental health and different social needs come up for my family, and knowing how hard it was for my mom as a single mom to drive an hour to find a therapist for my family and I, and things like that. And so the idea that findhelp.org is really focused on connecting people in need and the programs that serve them, but specifically with dignity and ease, that gets me up every morning, that I get to work for a company that makes it possible for people to find, and more importantly, connect to the resources that they need. And so the fact that I get to work with awesome people like you and awesome community-based organizations who are day in, day out on the ground, doing the work, serving their communities. The fact that I get to be a small part of that is pretty exciting.
Absolutely. And you know what, Vickie, I remember thinking the same thing once I stumbled upon the platform, thinking, man, this would have been cool to have as a resource when I was a younger kid, or whenever anybody, back in the early 90s or early 2000s, like, man, this would have been a very great resource. It's great we have it now.
Yeah, better late than never, I guess, right?
Yeah, absolutely. So, I know you have your social work background. You grew up with that. You had that heart. Did you ever feel during that time that social services or social work would really be in the discussion talking about health outcomes? Like, did you ever see that combined, or what was your thought?
I appreciate that you asked that question, specifically because it was not. I knew that when I was growing up, I knew I wanted to help people, and I bounced between career ideas in high school and even in college to some degree, that I wanted to help people, but I didn't land on social work until I realized that it was vague enough and broad enough that basically, to be a social worker, you have to be a people person, and you have to have the heart for it. And that's pretty much it. And that commitment to those ethics. And, but I never really considered the implication of, what we call our macro or community level health outcomes as a part of social work. I knew that I could play a small piece, maybe in an individual's life, but the idea that you really can apply the principles and ethics of social work in a community-wide landscape and really have tangible effects on health outcomes, I don't think is something we talk about. And I don't think it's something that's well understood. When you think about community social work, we often talk about lobbyists and policy work, and that work's critical. That work is so important because social workers can help amplify the voices of those with lived experience. But I think there are other creative ways that social workers can get involved in helping to shape community health outcomes. And so I was really excited that luckily I had a great friend apply at Findhelp. I helped her write her cover letter and then asked her to do some intel work. I was like, talk to me in 6 months, let me know how the company culture is. And after rave reviews, I was so excited that a position became available. So, but yeah, so short answer long, no, I didn't really consider that. And Findhelp has been a really great experience and platform for me to start to learn kind of that power of social work.
Right. So for those, before I get too ahead of myself, for those that may not know about Findhelp, what is Findhelp? What do you guys do, there?
Yeah, super important to cover. You betcha. So the Wisconsin's coming out. Hey, so Findhelp is we're an online resource. We list over 1,300 programs across every county across the United States. So these are local, state, and national programs. So really the breadth of services. The best thing about Findhelp is, in my opinion, that we're an open network, which means that we're available anywhere, anytime across the United States. All you need to get started in finding the resources that you need or that might be helpful for someone in your life is a zip code. So I love that feature because I have family across the states. I have friends across the states. And so whether I'm helping, my sisters in Columbus or I'm helping my aunt up in Minnesota, all I need is their zip code, and I can find programs. So it's not only finding the programs though, that's wonderful, is on Findhelp, you can also directly connect with those programs. So if a program has opted to participate in our network, which is always free and always worth mentioning that it's free, they have the opportunity to turn on referral tools so that people can directly connect with the click of a button, which is wonderful. And I really think speaks to health equity, because I know that for very good reason, communities of color don't trust health or social care systems, because getting involved often means a string of unintended or unforeseen consequences for them or their families. So you also have the opportunity to browse and connect anonymously to services, and do that for yourself. People are the experts of their own experience. They know what they need or what they don't need. And so being able to prioritize that and search. So that's Findhelp in a nutshell.
Yeah, that's awesome. And I think you brought up a very good point about being able to, now with my experience, yes, it has been me talking with patients and finding out where their concerns are through our conversation, and then bringing them to the Findhelp app or things like that. But they can actually download this and do it themselves. They don't have to go through someone else. They can really figure out what their needs are and do that themselves. And it's super easy.
Yeah. And that's one of the things that I love, is that the tool is really broadly applicable and flexible. So what's valuable to you as a healthcare coordinator and working with people, both from a health system perspective, but also as a member of your community, you can show people and teach people, and you have access to certain tools and things that might be valuable, like saving programs into favorites folders and stuff like that for easy access for you as a navigator. But it's so important because you know, and I'm sure are all too familiar with the idea that what somebody is comfortable telling you inside your four walls may not be the whole picture, but having this resource available to them, or should something change, right? Like somebody's living situation changes, someone's employment situation changes, their life changes, and they might need different things 2 weeks after seeing you. But having that experience, knowing that you trust it as a resource and that it's somewhere that they can go and reliably find help on their own, as well as in partnership with someone who knows the system. So it's really meant to be kind of that both and approach to accessing care.
Absolutely. So I kind of want to pick your social worker brain here and, talk a little bit about, how do you feel, social work or social services, how are they, especially now during this time of this pandemic, how do you feel like they are really helping our, our really most vulnerable and underserved populations?
Yeah, I think social workers are pivotal. I mean, I might be a little bit biased in that I certainly am, but I do believe that social workers play kind of this linchpin role of helping understand the full scenario, the full setting. Navigating the social care system is, if you've ever had to do it on behalf of yourself or a loved one, you know how challenging it can be, whether it's eligibility requirements, transportation, appointment management, and navigation with all of the other life responsibilities you have. And so from a navigation perspective, I think social workers are pivotal because they have kind of this system-wide lens. They understand who other players might be in the space that can be helpful. So in that respect, I think, as intended, or maybe as people would come or naturally think social workers help, I think they do. But I think what social workers uniquely bring to the table is, again, this ability to build relationships with individuals and to see them as a whole person. And when you're talking about being involved in care systems or in any system, building a relationship and trust is imperative, again, to make sure that you're understanding, okay, well, yeah, they're here today because maybe they need, housing, or they're having trouble with their car or something like that. But it's important to know that full picture. And social workers understand that and understand how to develop that trust. And especially in a world where you can't trust what you read on Facebook. You can't trust what you see on TV. It's the idea that we need more trust and we need more relationships if we're going to be making the tangible change that, real addressing root cause change that we know makes a difference when it comes to it, whether it's health outcomes or just outcomes generally speaking. If that makes sense.
Yeah, it does. Especially, when I think of social work and specifically within the healthcare system, the first thing that comes to my mind is trust, because, thinking of, our most vulnerable or underserved or, our Black and brown communities, there is a significant mistrust in the healthcare system, but having that person there to be able to support you through that and to guide you through that healthcare system that has no agenda. They just want to help. I think it really helps pick at that mistrust a little bit. And I don't know every healthcare system in the country, so I don't know if everybody has a social work team or has a social worker a part of a patient's care team, but I think it's so important just for that rapport and building that trust so they can navigate that healthcare system and get the care they need.
Yeah, and I think you bring up a really good point in terms of, whether or not all systems have social workers. And in my experience, they absolutely don't. And even if they have social workers, how many do they have compared to, what the capacity is of their system?
Right. Mm-hmm.
And because really, I think just a missed opportunity is, and coming from someone, I worked in direct services for 5 years, I think it was, before I went back for my master's. And just like anyone else, right? We're all burnt out a little bit, especially again, people where compassion is the meat and potatoes of what you're doing. Compassion fatigue is real, burnout is real. Mm-hmm. And so I think it can be a missed opportunity, but where I think social workers have power is meeting people where they're at and validating and normalizing that. So when we talk about the mistrust that Black and brown communities have in systems, generally speaking, but specifically the healthcare system, not dismissing that and not putting, making sure to hear that, to have space for that, and then to work with that person, not for that person, to say, you're absolutely right. I understand how you're feeling, and that is messed up. And how can I help? Like, how can I use my privilege and my power to be your ally in this space? And if you're overworked, you have a huge caseload and you're discharge planning for a hospital, you may not have time to have those conversations with people. And so it's not just about the presence of a social worker. I think it's the intentionality and investment, recognizing the power and validity that social workers can bring to the table.
Yeah, I was just thinking, I don't think a lot of people understand the all that you can do, right? Like, I feel like most people feel like, okay, social work, okay, you provide service for therapy, or you provide service for people in this category or this category, but there's so much more you can do to really provide a service and to improve health outcomes for people.
Yeah, and I think that's very much the perception, right? I remember my very first social work assignment, and this might be an aside, but my very first social work assignment as an undergrad was to ask, I think it was 5 different folks in my life, friends, family, whoever, what do social workers do? And that was it. That was the only prompt, and to collect the responses and analyze those trends. And by and large, most people don't know. And the response I got most often was, don't you take kids away from families? That's what social workers do.
I was just going to say that.
Yeah. That's the perception. And which I think, as the social workers I know and love, we spend a lot of time developing relationships and not a lot of time on marketing. So some work to do there. But I do believe that, and one of the reasons I landed on social work, like I mentioned, was because it was so general. It was so vague. There were so many different ways to implement the skill set. And the language that really my education helped provide and my learning experiences. So social workers all have to do kind of an intense, and this is similar to other professions I know, but an intense internship process where, you're having classes alongside your internship to all of these different things. And so learning and applying, and I don't know, there are so many different skills that each individual social worker has. And again, I think it's understanding, and I do think it's shifting though, Corey. I think that we're seeing a shift in health systems and in just the health space, understanding the importance of things like care coordination. That's something that social workers, it's again a bread and butter thing, compassion and care coordination. That's pretty much it. But understanding that the care coordination is more than just scheduling and calling appointments. It's really, again, meeting people where they're at and understanding where they want to go. That self-determination piece is absolutely everything to social work. And it's also one of the things that I've found aligns so well with Findhelp as a company. It's this idea of people are the experts of their experiences. People know what they need. And if they don't, they have an idea. And really we should follow their lead and just help them as they need it.
Right. Exactly. That's great. There are a few things I want to touch on, but before I go there, how do you feel like the work at Findhelp, has it changed or expanded due to the pandemic? What are some things you feel like you guys had to maybe pivot on or pivot at all? How's that been?
Yeah, so I'm it's so, again, funny you should ask that, Corey, because in my time, in my brief 10-month stint with Findhelp so far, we've changed our entire name. So you mentioned that we were previously known as Aunt Bertha. And so that story is one that I don't tell often anymore, but the idea behind Aunt Bertha as a name for the company was this idea that Aunt Bertha picks up where Uncle Sam leaves off. And the idea that it was a quirky enough name for folks to remember, and hopefully getting folks to
hard to forget.
Yeah, right. We got called Big Bertha a lot, so that was something we had to work with. But not Big Bertha, in fact, Aunt Bertha. But one of the things we found, and a change that happened before my time, but recently, kind of as a result of the pandemic and the just extreme shift in need of services that brought, was that, so what was previously the directory of AuntBertha.com became Findhelp.org. And so thinking that was a more intuitive URL, that people would hopefully find it more easily, which is, again, really the meat and potatoes of what we try to do. We really want people to be able to find what they need with ease. So we thought that that was a strong change, and we noticed an increase in traffic. The data really showed us that that was a strong move. And then after just consulting with people that we work with, our partners, our community-based organizations that we partner with, we did work with some marketing folks and all of that good stuff, realizing that it made a lot of sense to align our brand in total to just be Findhelp. So we still do business as Aunt Bertha and all the tax things that we'll be seeing soon, but that was a specific change that we've made in my time to respond to need. In terms of other changes that we've seen or implemented during the pandemic and just recently, is I want to say that we've done we're gonna have to edit a little. I want to say that we've done a really good job of listening to what our users need in terms of functionality and how that works. So what I mean by that is the idea that we are really trying to help establish trusted network relationships. So we think it's always important to have the whole host, the whole breadth of social services available to individuals. But we're also, it's not an either or. We also think it's important to start going to where we're seeing traffic and saying, okay, we've got people who are really searching here. We've got people who are really trying to connect with services here. How can we work with our customers, work with our organizations to say, you know, we're wanting to develop some trusted partner networks, and we are really looking at what it looks like to close the loop on referrals and what support is needed. And so one of the things that I've been really excited about seeing in my time is just the rapid growth of Findhelp to make sure that there is support regionally across the country. So our team is based in Austin, Texas. I'm in the Midwest, and so I'm the Midwest CEM, but I'm really excited. I know our team is going to continue to be growing over the next year, just because as more people are finding out about us, we want to make sure that everyone has the attention and support that they need kind of through the process of whether it's your program provider and you want to know how to optimize your listing, or you're somebody in need of services. We want to be always want to be able to provide that support.
Yeah, absolutely. And which is definitely needed right now. Mm-hmm. So you said something before, and we talk a whole lot about burnout, but we never really talk about compassion fatigue. Mm-hmm. Like, mm-hmm. It's real. When you said that, I felt like I heard every social worker in the Midwest go, amen. Yeah. What has your experience been like? Well, first, let's kind of explain compassion fatigue, and what's your experience been like? And as a social worker yourself, what kind of advice may you have?
Yeah, so compassion fatigue is that experience of running out of gas, the why that keeps social workers going, I think, is everything. No one chose social work because they wanted to be rich or because they wanted to be famous. And so we're really driven by that. And I think what can be hard, and I know that it's not unique to social work, it's nurses. I have friends who have nurses. My mom's a physician's assistant over in La Crosse, and I know that she's experiencing this too, where your cup can only be so full, and when it's empty, it can be hard to refill. And so part of that is just the nature of the beast. That's the job. When you're working with people who have experienced trauma, you get that secondhand trauma. You hear things and you live through things. You struggle when you are caught up against systems where you want to help, but your hands are tied and there's nothing you can do. And that's certainly been my experience, where that's actually why I went back for my master's degree in social work, was because I knew that there were things that I could not change as a care coordinator that I wanted to change, or that I thought needed to be changed. And so that was enough to propel me into my master's degree. But in terms of addressing compassion fatigue and what that can look like, I'm afraid I don't have an answer for you. I think, especially with the weight of today's world, mm-hmm. I think it is both misplaced and honestly, sometimes I'm insulted by the idea that we can self-care our way out of the weight of today's world. The problems that we experience today and that we're grappling with, that's not a bath bomb situation or light a candle situation.
Right.
Like there are people dying. There are people who are, fighting to survive, and it's heavy. And so I think normalizing that and talking about it can be really helpful. I'm one of those people where I can only live in that space of compassion fatigue for so long before I have to do something. So whether it's a vent session with a friend, whether it's an inspiring conversation with a community partner, or hearing from people like you who are in that navigator position and how you've used something is like Findhelp to really make a difference. I think it's checking back in. It's that perspective of like, okay, let's reassess. How have I made a difference? Or what can I do tangibly to make even a small difference? And those small wins add up and start to fill your cup again. And that's been my only way out of it, especially over the last couple of years, is checking out when my cup is dry, which is not something most people have the luxury of doing. And I totally recognize that as a privilege of both remote work and also, again, my white cis hetero privilege of I can check out when my cup is dry. But yeah.
No, I think that's really really good. I remember when I was, I'm still in the helping profession, but within social work. And I think it's just one of those things where, one, if you have a heart for compassion, it doesn't take many wins to refill that up. Like you kind of only need like a couple, and you're like, okay,
I'm ready. I can do this.
Yeah. Right. But I remember when I worked for a nonprofit called Orchard Place, and I worked with kids there. And when you're working with kids 40 hours a week who are not nice at times, but they're going through their own go through. Sometimes you forget they're going through something, and you're just like, I don't care nothing about these kids. Right? Like it happens when you're getting books thrown at you, or they're saying racial slurs at you to get under your skin, or whatever the case may be. After a while, you're like, whatever. But I remember my boss told me one time, whenever you feel like you don't care, go read their file. Right. So there are multiple times where I had to take a step back and go reread somebody's file on why they're there. And it was like, wow, I couldn't even imagine living a week in their shoes. Right.
And you expect them to care about whatever you care about, right? Like you're mad at them and I totally know. I worked at a residential facility for youth after I graduated, and it was only a few months that I worked there. It was third shift, and I'm a morning person, so it was really not for me. But totally, you as the care provider, like I care about these things, and I need to get these things done, and you can't expect them to care about that when they're carrying all of those scars and those battles with them. And yeah, man, that is actually the same advice I think that I got. That read their file, and that perspective taking means
it's all about perspective. Absolutely. Well, Vickie, thank you so much for being on with me today. I super appreciated it. If anybody wanted to get to know more about Findhelp and the work you do with findhelp.org, or if they just wanted to connect with you, where can they find you?
Yeah, absolutely. Well, you can find me on LinkedIn. I've got my LinkedIn profile ready to rock in anticipation of high traffic. No, just kidding. But no, if you're interested in learning more about Findhelp, we do have the social media situations on deck. So we've got both an Instagram and a Twitter. And I think we have a TikTok, which is incredible to me as an elder millennial. But you can find all about us at findhelp.org. You can always feel free to do some quick searches and see what's available in your community. So yeah, if you'd like to get connected with me personally, I'd welcome the opportunity. visit my Vickie Walsh LinkedIn profile. Otherwise, head over to Findhelp social media, and that'll get you started.
Yes, and all those links will be in the description of this episode, so you can definitely find them there pretty easily. Again, Vickie, thank you so much.
Yeah, thank you so much, Corey. Appreciate it.
Yes, and everybody, thank you for listening to the Healthy Project podcast. I'll holler at you next time.